In this video, I'm going to talk about the number one thing you need to bear in mind when you're getting back into strengthening your lower back in particular and the core region if you've had an episode of back pain or some sort of back dysfunction, and that is the lordosis. It's the natural arc in the spine. This is the back and this is the front. It has a nice smooth curve in it, and that is the most important thing when you're coming to strengthen your core, strengthen your lower back muscles. And I'm going to take you through what you should be thinking about as you move through that rehabilitation. So number one, when you're coming straight out of an episode of back pain, doing exercises that maintain that lordosis. Lordosis is a good thing. Sometimes patients come into our clinic and they say, oh, I've been told I have lordosis. And that's the equivalent of going to your GP and saying, and they say you've got lordosis, they basically may as well say, oh, you've got two legs. It's what everyone should have. It's completely normal. That lordosis allows no excess stress to go through one part of your lumbar spine. Instead, it's the weight is distributed evenly through that lower back and all the structures, the discs, the facet joints, the muscles, the ligaments, etc. So it's a good thing to have that lordosis. And when you're going into those first stages, the preliminary stages of a rehabilitation for your lower back and back strengthening exercises, you want to be keeping that spine in that neutral lordotic position when you're doing all of your exercises. So this could be things like side planks. It could be abdominal rotations, whereby the spine stays neutral and you're just going through twisting or just engaging the side muscles through the side of your obliques, essentially, to strengthen those up while the spine remains still and in a neutral lordosis or lordotic position. The next step you want to take is moving into strengthening exercises where your back is still supported. So this would be things like seated seated chest press, seated rows, where you've got the pad in front of your chest, not to be confused with some of the other rowing machines where you have your feet on the machine and your back does take a bit out load. If you're using the right sort of machine, you'll have a chest pad here, you'll be able to do your rowing motion without any stress going through the lower back. Again, remember, keep that lordotic position at all times and focus on the large muscles like the lats, etc., taking the load and strengthening that section of your back as well. From there, you can move on to more complicated exercises, again focusing on that neutral lordosis in the lower back. So things like lunges with a weight on one side. One good one we get patients to do that's a little bit more advanced is lunging, holding a kettlebell up on this one shoulder or on the other shoulder. You're keeping the spine nice and neutral as you're going through those lunging exercises. And yes, lunges aren't explicitly a lower back exercise, but it trains your core and those lower back muscles and the lower back stabilizers to deal with an asymmetrical load as you're going through a dynamic movement, and that's equally important. And the final step is moving on to things like squats and deadlifts. Again, if you've been through the rehabilitation properly and when you're doing your back strengthening exercises, you'll actually be able to develop habits that mean when you go into those squats, those deadlifts, starting of course on lighter weight, focusing on technique and higher reps, you're able to maintain that good form, maintain that ever key lordosis, and make sure that you don't re-injure yourself in the future. And do make sure that you don't put the weights up too fast so your spine can effectively learn to deal with that increased load bearing that it's having to go through in the gym, and you can adapt slowly in due course. So if you want to learn about more information on lower back, on back pain, sciatica, those sorts of things, then make sure you subscribe to our videos and click the link and have a look on our website, because we've got tons more information and guidance there. Hopefully you found this video helpful, and if you did, remember you can subscribe to our channel so you get updates, hit the notification icon if you're watching this now on your desktop, and also there'll be a few videos just on the one side here that may be of interest. And remember, share the page with other people that may find it helpful. Most back pain can be resolved and avoided if it's dealt with soon or quickly with the right advice.